So Dave Clarke, this is just such a treat to have you here. I'm delighted that you wanted to talk about your really interesting work with us here today as part of our little story series. And you've had a fascinating medical career as a gastroenterologist and internal medicine doc who has specialized in psychophysiologic disorders. I have to say that several times just to make sure I get it right. And you've also otherwise known as stress illnesses. Can you describe stress illnesses and then how you became interested in identifying and treating them?
Yeah, you bet. It absolutely was not part of the plan. It came as a surprise that I got into this at all. I didn't know anything about it the first 7 years of my formal training, but then I encountered a patient that nobody could diagnose or treat successfully, except a psychiatrist at UCLA where I was in training that cured this mystery patient with less than 3 months of counseling. And that was what kind of opened the door. And what these illnesses are, most people assume that if you've got pain or illness, that it's got to be due to disease or injury. But it turns out, and there are numerous randomized controlled trials now that back this up, and hundreds of other research papers as well, that your brain can generate pain or illness in your body. Real, not imaginary physical symptoms that can be incredibly debilitating. I've had many patients in the hospital with this, many patients with symptoms for decades, and it can be almost anything: migraines, fibromyalgia, irritable bowel, brain fog, many cases of long COVID, many cases of chronic fatigue. Back pain is a big one, pain pretty much anywhere. And, again, very real symptoms. But the good news is that if you can uncover the psychosocial stresses that are responsible for this, and they're not always obvious either, that's part of the skill of diagnosing these patients, is to find what the stress is, because many times it's all the way back when the person was a child that they suffered some adversity, and it's had it play out over the course of their lives. But if you uncover the stress, you can treat it successfully and alleviate people's symptoms just, even more successfully than we can the rest of our patients.
Wow. So actually, that was my next question is how do you successfully treat PPD? We'll just call it PPD right now. Can you give an example of a patient who overcame debilitating symptoms under your care?
Yeah, I love to tell the story of a patient that's actually the first one that I shared in my first book. The book is called "They Can't Find Anything Wrong," and the
Mhm.
title is taken from this patient
Mhm.
because that's what she told me when I first went to see her. In fact, she recommended that I not waste my time with her, that I'd be better off seeing my other patients. And she had good reason for saying this because she had been hospitalized 60 times over the previous 15
Wow.
years at a prestigious university medical center
Wow.
where she saw a dozen specialists, including a psychiatrist, and they still had no idea what was wrong with her. But by then I had learned, and this was, back in the 80s, I was still fairly new at this, but I had
Can I ask
learned,
what
yes,
symptoms? What
yeah,
symptoms?
attacks of severe dizziness and vomiting. They
Okay.
would just come out of the blue somewhere between 6 and 10 times a year. And half of them were bad enough to put her in the hospital because they would, last for a couple of days.
Mm-hmm.
And she went through every test you can imagine.
Mm.
But, it turned out there were only two pieces of information that were needed to figure out what was going on. Number one was that she had been verbally and emotionally abused by her mother starting at age 4, and it was still going on now that she was age 50.
Wow.
So she had, enormous emotional tension in that relationship, as you can imagine. And the other clue was that she always got one of her attacks whenever she passed through a little town about 40 minutes from where she lived. But the
Hmm.
only time she went through this little town was when she was on her way to visit her abusive mother. If she
Whoa.
was going the same distance for any other reason,
Uh-huh.
going an hour and 40 minutes for some other reason, she would never get an attack. So there was
Wow.
clearly a link there.
Mm-hmm.
And her husband, when he heard this, he remembered that she would get her attacks after phone calls from her mother. The attacks that happened in and around her home community always followed a phone call from her mother. So
Wow.
when she saw, how this was all connected, she was able to set strong boundaries around, her mother's behavior and how much contact she had with her, and the illness basically just stopped at that point.
Wow.
So the it's a good example of looking for stress in the person's life right now, looking for adverse childhood experiences that they went through years ago that can play out in long-term impact for years or decades later. And I also look for unrecognized depression, anxiety, or post-traumatic stress that happens surprisingly often, that you can have those conditions and not be fully aware of it.
Yeah, you had quoted, you had told me this line, uh, this question that I found so powerful. What did you learn about yourself as a child that isn't true? And that has really stuck with me because, boy, that gets you digging deep.
Yeah, it's such an important question for my patients who went through adversity as children, because many of them underestimate or repress how much they went through as kids. So
Right.
I will often ask them, well, how would you feel if your own child or a child that you care about went through everything you did as a kid? Would that make you sad or angry? And that
Mhm.
helps people recognize the reality of what they experienced. And then I'll also want to find out, as the question you pose, what did people absorb from that experience as fundamental assumptions about themselves that aren't true? Did they learn that they're a second-rate human being? Did they
Mhm.
learn that it's their main job in life to solve other people's problems and devote themselves to the
Yeah.
needs of others? Because that puts you on a very stressful treadmill that it's hard to step off. But
Yeah.
when people see where they learned this from, how they absorbed these false assumptions from their early environment, then they can begin to make changes and the stress level starts to come down.
Wow. So you're a founder and the director of the Psychophysiologic Association, also known as the PPDA. And you describe its mission as awareness, education, diagnosis, and treatment. So can you tell me more about this association and what you've accomplished and what you are looking to accomplish?
Yeah, I've had tremendously rewarding experience there. It was started by me and a bunch of colleagues from a whole range of different healthcare professions in 2011, and I've been the president ever since then. And we have sponsored two major research studies, three documentary films, two textbooks. We put on multiple live and virtual conferences. We have our next conference coming up September of 2024
Mhm.
in Boulder, Colorado.
Mhm.
We've got professional training courses that are video based on our website. We have one for patients as well. We do monthly Q&As via Zoom that are international, where people can join and ask questions of experts. So we're trying to get the message out about this. We've got a bibliography of over 200 research papers that
Wow.
supports the work that we do. And I get invited to give presentations all over North America and Europe, speaking in London next year.
Wow.
I've 1 week last October, I gave 13 hours of presentations in 4 different cities in just the 1 week. So there's a lot of interest in this, especially with the opioid epidemic,
Yeah.
because we offer a viable alternative to
Right.
throwing narcotics at people's pain.
Wow. Yeah. Didn't you mention that just recently you talked to a filmmaker who was so excited with her own recovery that she talked about wanting to do a documentary?
Yeah, this is an actual real live film director, does feature films, but she got long COVID
Mhm.
and was, ill for well over a year until she found our materials and recovered as a result of
Wow.
using our approach. And she's so enthusiastic that she wants to do a documentary film for us at bargain rates. So we couldn't turn that down. She's going to come to our conference and
Mm.
film all the experts who are coming there, and a number of the patients who come as well.
Wow. That's fantastic. Um, and who does the conference target? I mean, who are the people that you most wish would attend? Are these lay people or mostly medical professionals?
Yeah, mostly medical professionals. We have a lot of mental health professionals that do this work. The problem with this whole condition is that it's a giant blind spot in the healthcare system. The medical clinicians don't learn the psychology of it, and the mental health professionals don't learn about people who are physically ill, who have pain or non-pain physical symptoms. And so there's nobody that's specifically trained in what to do for this population of patients, which is 20% of the adult population. It's 40% of people that go to see a primary care doctor.
Mhm.
So it's 50 million adults in the United States alone. So we invite everybody to come to our conference. We have medical clinicians, physical therapists, mental health professionals, people from the general public that have been suffering from this condition and want to learn more. It's we emphasize a jargon-free conference so
Mhm.
that everybody can understand the material that's being presented.
Mhm. And this is my question, because I've been interested in this in decades, this whole concept of stress illnesses. But I feel like you've got quite an uphill climb in that people, the term was always psychosomatic. And that is a very, as you and I talked about, it's a very denigrating, what was the word that you used?
Pejorative, yeah.
Pejorative term. Yes. And it's that idea that it's all in your head, which really is dismissive of the sufferer. How are you choosing to work through that barrier of perception?
Yeah, we're actually thinking of changing our brand a little bit and calling them just stress-based conditions, because
Mhm.
that's what they are, and there's less of a stigma to having stress. Everybody's got stress these days, and the
Yeah.
idea that your brain can generate real symptoms in your body is, we hope, a small step from there. And
Mhm.
once people recognize that, they'll start to think, well, okay, if I've got stress causing problems in my body, what's the stress? We want to shift
Mhm.
the attention from what's happening in your body where the diagnostic tests are not showing anything, which means your body's okay, to finding the stress. And we've got, obviously lots of good ideas for where people can look for this. We have a wonderful 12-item self-assessment quiz on our website. It
Okay,
takes
cool.
less than 3 minutes, and it's set up so that the more questions to which you answer yes, the more likely it is that your symptoms are brain generated.
Wow, excellent. And we're going to include links to your website and so forth, when we post this. So one last question. I'm curious about how you've applied what you've learned about stress illness in your own life.
Number one, I think, would be gratitude that I didn't go through any of these issues myself.
Mhm.
I was so fortunate not to have suffered what so many of my patients have in their lives. And, when I would interview a patient like this during the course of my day, which was more days than not, I would just go home and hug my wife and kids a little longer, just because
Mhm.
I didn't have to go through what they did. But the other one, I think it was important, was it helped me change how I raised my own kids. And listening to story after story about the difficulties that people had gone through,
Mhm.
even from well-intentioned parents who wanted the best for their kids, but who were creating inadvertently enormous amounts of pressure. And my wife and I tried to create in our home an oasis of support for our own kids, because then when they left the home, they were going to face a lot of challenges, but we wanted them to know that we had their backs. And both of them are just amazing to me today. I mean, they're wives and families and professional success, and they competed nationally as athletes, both of them. They're just amazing kids.
Fantastic. This has been terrific. I really appreciate it. I hope, people follow up and want to contact you, because I'm certainly interested in learning more about what you're doing and getting a copy of your book and so forth. So thank you so much, Dave. And I do hope that you're going to be at Reunion, because I'm sure people will want to talk to you then about all kinds of things, but also about your work, because it's really
I'm
fantastic.
planning to be there, Nancy, and thank you so much for your interest in this.
Thank you. Now I'm sorry, I thought I knew where the end button was. There we go.